brought in the Army Corps of Engineers. They built 2,500 beds at Javits that Michael and Northwell were operating. It was a phenomenal accomplishment. Close to 1,000 people have gone through Javits. Luckily, we didn't need the 2,500 beds, but all the projections said we did need it, and more, by the way. So these were just extraordinary efforts and acts of mobilization. And the federal government stepped up and was a great partner. And I'm the first one to say it. We needed help, and they were there. State and local governments were fantastic. The hospital system was fantastic. New Yorkers were fantastic. And that is an undeniable fact. Just to look at what they said was going to happen. CDC, Coronavirus Task Force, Cornell, McKinsey, all of them. And they had a line up here, and the actual line is down here. What do you owe the variance to? Heroic efforts on behalf of people as facilitated by government, federal and state.
We actually had something else. Are they finished with that? They left out the good part. Great job, fellas.
What was the good part?
They did a better job on ventilators. No. Andrew had something else to say that was really nice, but we won't go through that. But he really, I mean, it was really a good statement. Do you want to put the rest of it up, or do you not have it? I just think it's so good because it's bipartisan. You know, this is not about Democrats, Republicans. This is about a thing that hit our country, the likes of which has never happened to us before. Wars, those wars, Civil War, sure, but the First World War, the Second World War, they're not fought on this country. This is being fought in this country, but it's being fought in 184 countries all over the world. It's terrible. But I want to thank Andrew, Governor Cuomo, for the statement. He actually, if you go a little bit further, it was even far beyond even that. So it was good. Do you remember? Huh? Well, that's okay. Whatever. But he said some really good things, and that's it. It makes people feel good. It's actually the Wall Street Journal. Christopher was saying, I want to make people feel good too. I want to make, when they're doing a good job, I want to make people feel good. I want the Admiral to feel good. He's worked so hard. Mike has worked so hard, and it was very nice. It was on this morning. It was Andrew this morning. It's a little longer clip than that, but you'll see it was really a very nice thing that he said, and people really appreciate that because they've done a great job. The federal government's done a great job. I mean, with all of it, and this is easy. The swabs that's easy. We have them coming by the tens of millions. We have them coming at a level that you'll have so many swabs you won't know what to do with them. That's easy. So they'll all be there. A lot of them are there already. They're learning about their testing capacity that they didn't know about that we have in the various labs, including academic. They have to remember you have a lot of these big colleges that have labs that are totally ready to help. But I want to thank the Dynamic Ventilator Reserve because what they've done is incredible. It's a capital DVR, by the way, an innovative public-private partnership. That's what we created. We're gaining access to up to 65,000 additional ventilators in hospitals across the nation that can be redeployed very quickly to areas with the greatest need when they're not in use. And we right now have almost 10,000 in our reserve. We've been able to give away thousands, like we helped Andrew, or we helped Phil in New Jersey is doing a great job. Andrew would tell you that, too. They have a very good relationship working together and working with us. But we have now we're back up to almost 10,000, and this is after giving away tens of thousands of ventilators. And we're going to fill up the reserves of states. We're going to work with them so in case this happens again. But we're also going to help other countries. I was telling you, the president of Mexico, we're going to be sending a pretty large quantity to Mexico. They very much need them, and to other countries where they need them. I've had about 6 calls with leaders of other countries, and they need them. They're hard to get done. Our companies stepped up and they did an incredible job. Some of them were automobile companies, and they take an assembly line and they'd say, guess what, we're making ventilators now for a while. But because of these historic steps that we've taken, I remain confident that every American who needs any of this equipment, any of the things we're talking about, will either have it now, already has it, or will shortly have it. Through the Project Airbridge, we've completed 64 flights carrying over 600 million pieces of personal protective equipment, such as gloves, gowns, and other medical gear, with 50 more flights scheduled in the very near future. The team doing that is an incredible team of military people and young geniuses. Some are older geniuses, but mostly younger geniuses, I think I can say. Some are people that made vast amounts of money in Silicon Valley. And, these are very smart people. The job they've done is incredible. And I said, where do you come from? Well, I sold my company, sir. Oh, really? How much did you get? I think he said $700 million. I said, that's good. You want to work for the government? No, I want to help our country, sir. And it's tremendous brain power. It's a beautiful thing to see. Young, incredible people that love this country, and they worked with the military. Admiral, you would say they were pretty smart, right? Yes, sir. They were in the upper scales of IQ. Yes, they were the upper. They were the top scale, I'll tell you. And they're great people. But FEMA is working to commit another $384 million to produce another 64 million gowns for healthcare. These are the highest quality, where they're very safe. When you put them on, they're safe. Very important. The quality of the gown is very important. It's people in different places, different countries, they're wearing gowns with cuts in them, and these are very safe. I want to thank America's textile manufacturers for their partnership in this remarkable undertaking. 2 U.S. companies, Hanes and Standard Textile, are on track to produce 5 million gowns by the end of the month. And that's really moving. That's really moving. 2 great companies, the companies. Another great American company, Honeywell, recently began manufacturing N95 masks in Rhode Island, where they converted a factory in less than 5 weeks instead of the 9 months it was normally expected to take. So they've already done it, and they did it so rapidly. 5 weeks instead of 9 months. It's amazing, the spirit of this country. It's really about the spirit of the country. We said, do it fast, but they did it in, and this was a major conversion too. This is a different world. Honeywell is hiring more than 1,000 American workers to produce 20 million masks per month. 20 million masks a month. Thanks to the Defense Production Act, we'll be receiving another 40 million masks over the next few weeks. And I also want to thank 3M, because they really stepped up. We had a little dispute at the beginning, but that got worked out quickly, and they've been doing a great job, 3M. They really have been. I want to thank their great CEO. We had a little skirmish, but it worked out well. And they're doing a lot of work right now on masks and other things. This production is in addition to the 55 million N95 masks my administration has already distributed. Plus we ordered, and it's coming in soon, 500 million masks. You would think, what are you going to do with them? They get used rapidly. In addition to that, as you know, we sterilize masks now. Great company in Ohio, recommended by the governor of Ohio strongly. And it's doing very well. And they're sterilizing. A lot of the masks can be sterilized up to 20 times. So that's like buying 20 masks. And I always wondered, why aren't they sterilizing these masks? Some of them are pretty sophisticated masks. And some you can't because of the material. Others you can. But we have actually 2 companies that do this, but one company I know very well in Ohio, and they're doing a great job. So they're sterilizing masks up to 20 times you can sterilize a certain type of mask. To these numbers in perspective, and to put them into perspective, American healthcare providers use an estimated 25 million N95 masks nationwide in a typical year. So a typical year, 25 million. That means we've secured nearly 4 times as many N95 masks in recent weeks as we would in entire healthcare industry during a typical year. Over a matter of couple of weeks, we had more masks than we would do in a year. Think of that, over a couple of weeks. Moreover, we're bringing supply chains back home, and we've learned a lot about supply chains. We've learned that it's nice to make things in the U.S. I've been saying that for a long time. One of the reasons I ran for office, because we started making things everywhere but here. And if one thing comes out of this, more than anything else, it's that we should make product in the United States. And these supply chains, they sound wonderful. But if one country has a problem, the whole chain is ruined. And I've been saying it for a long time. I ran partially on that. I ran on that, and I ran very strongly against China. And then we made a great trade deal where they buy $250 billion. They're supposed to. And they're paying tariffs. They paid us tens of billions of dollars. I've given $12 billion one year, $16 billion another year, and $19 billion to our farmers and ranchers who were targeted. But, I ran on China and other countries the way they were ripping us off. They were ripping off our country. And China understood that. I mean, China fully understood that. And they're big, strong, smart people. And I wasn't friendly, and it wasn't a friendly situation. And we ended up making an incredible deal with China for tens of billions of dollars of product, $40 to $50 billion to the farmers. The most they ever spent was 15 to 16. Now they're supposed to spend 40 to 50. Now, of course, the virus came along, and I'm not happy. I let them know I'm not happy. So, we had a great relationship we had a very bad relationship with China. Then we had a good relationship because we made a great deal. But we're not happy. This is not a good thing that happened. Came out of China, so we're not in a position where we're going to say much yet. But the deal itself is great. The deal it's going to put many, many people to work in our country, but all of that has to be taken into account when you look at all of the people that are dying in our country, but all over the world. All over the world, people are dying. I had a G7 call, and their economies are in tatters. They're shattered. The G7 countries. You have Japan and Germany and France. The different countries, Italy. Look at what happened to Italy. Look at what happened to these countries. Look at what happened to Spain. Look what happened to Spain. How incredible. It's just been shattered. And so many other countries are shattered. So nobody ever thought this could have happened, a thing like this. It's very, very sad. But if we've learned something, it's about supply chains. I just saw yesterday where when the auto industry gets back, they have a problem because there's a supply chain going through a different country. And this has been going on for years, for decades. I always said it was no good. Why do we make it? Why do you need a supply chain? Very simple, make your parts here. They get one part from this country, one part from that country. It's all over the place. The problem is if one country has a problem, you have no car or whatever it is you're making. So we've learned a good lesson. I think a lot of smart people knew that before. But we've distributed many hundreds of millions of masks. This pandemic has underscored the vital importance of reshoring our supply chains and bringing them back into the United States where they belong, where they should have never left. What happens if you're in a war and you have a supply chain where half of your supplies are given to you by other countries? Who are the people that thought of this? These are globalists. It doesn't work. It certainly doesn't work during rough times, bad times, or dangerous times. So we're going to continue to fight the virus. We're talking to China. We spoke to them a long time ago about going in. We want to go in. We want to see what's going on. And we weren't exactly invited, I can tell you that. If you look at some of the investigations that are going on in terms of World Health Organization, and I'll take it a step further, World Trade Organization, too. World Trade. We did years ago, many years ago, the World Trade Organization, from the day China came in, that's when China bloomed. They were mainlining it, and then boom, they were up like a rocket ship because they took advantage of every little ridiculous clause in the World Trade Organization documents. They were a developing nation. China was a developing nation. They make the cars, they make the plant, they make everything. And they're a developing nation. So we've had I might have gotten elected to a certain extent because of China and other countries. One of my big things was trade. The United States is getting ripped off in trade. Now Japan is paying $40 billion and buying a lot. That's before we even do the deal. U.S.-Mexico was a great deal. The NAFTA was one of the worst deals ever made in trade history. And I would also put the World Trade Organization in that same group. So I was very tough on these countries. With China, we made the deal, and we became friendly. But then this happened, and this is tantamount. This is something that's really incredible. I do want to read something that I just saw today on television. I was looking, and I just said, that's an interesting statement. We talk about the Democrats, and it was a statement made by Bret Baier, good guy, smart. On February 19th, there was a Democratic debate in Las Vegas. That was February 19th. That's way after I closed entrance from China into our country. So Bret goes, on February 19th, there was a Democratic debate in Las Vegas. 3 words weren't said during the debate: virus, coronavirus, or COVID-19. Those 3 words never came up. That was, I just thought it was a very interesting, because, you know, you hear these people, some of the people, the Democrats said, oh, this, that. It never even was a part of their dialogue. Now they bring it up because you see what happens, so now, but they didn't bring it up. But I brought it up. I brought it up a long time before I made the trade deal, and I was not easy to deal with. I was not easy to deal with. They understand that. We still have 25% on $250 billion that they have to pay us. And it's a lot of money. We've taken in a lot of money, and we've had a lot of beneficiaries, including our farmers and ranchers. So in addition, we've launched an unprecedented effort to develop new treatments and therapies to battle the plague. Therapies, to me, are the most exciting. The vaccines are obviously so important, but the therapies are immediate, you know, and we have some things that are really looking good. Really looking good. We call COVID Treatment Acceleration Program. We're accelerating all of these great companies that are looking, and we have government agencies looking too, NIH. This extraordinary program is slashing red tape to speed and development anti-rival, and if you look at what we're doing in terms of the speed, it's unrivaled. It's totally unrivaled. There's never been anything like it. The FDA and Dr. Stephen Hahn, a highly respected man from a great institution, left that job to come here. The job he's doing is incredible. And we're working with Scott. His predecessor was terrific. We're working with a lot of people, but the speed of development for antiviral, antibody, and immune therapies is at a level that nobody thought even possible. And I will say this, we're getting very good results. It's a little soon yet, but if we could find the therapies that would solve the problem, if somebody has a problem, we can get it taken care of so it's not so devastating as it has been. With that, I'm going to ask Vice President Pence to come up, and I have to say it's a Sunday evening, and this man has not stopped. He's working. We all are, in all fairness, but he's been working with his task force and everyone else round the clock for months, and I just want to thank Mike. Thank you, Mike.
Thank you, Mr. President. And let me echo your words about all the dedicated men and women on the White House Coronavirus Task Force, and the team that you assembled in January, and some of whom are with us today: Seema Verma with CMS, Admiral Giroir with the U.S. Public Health Service, Dr. Steve Hahn of the FDA, and others represent a level of commitment and dedication that's been inspiring for me to have the privilege to work with. And so I thank you for your gracious words. That White House Coronavirus Task Force met today. It was reported to us that at this moment, more than 746,000 Americans have tested positive for the coronavirus. Unfortunately, more than 68,000 Americans have fully recovered. But sadly, more than 41,000 Americans have lost their lives to the coronavirus. And we always want to express our deepest sympathies to the families in their loss, as well as to all the families who have loved ones that are struggling with this disease. Today, we've seen encouraging news, again, about our progress as a nation. President Trump reflected on those momentarily, but the coronavirus White House task force today learned that our large metro areas continue to stabilize and even see progress. The New York metro area, including New Jersey, New York, Long Island, Connecticut, and Rhode Island, all appear to be past their peak. The Detroit metro area also appears to be past its peak and is stable. New Orleans metro area actually is the most stable of all areas where we had a major metropolitan outbreak. And the Denver metro area is stable. We're dealing in Colorado with a meatpacking plant issue. And of course, California and Washington remain low and steady. Areas that we continue to watch carefully on the task force include the Chicago metro area, Boston metro, and the Philadelphia metropolitan area. The progress that we are making is a tribute to the American people. It's a tribute to state and local leaders in all of these areas and the partnership that our president has forged. But we just want to encourage every American, as we see this progress, to continue to heed your state and local authorities. I think the American people know no one wants to reopen America more than President Donald Trump. But I want to assure you, we're going to continue to work with the governors of every state, with the president's guidelines for opening up America again, and we're going to work in a way that we can consolidate the progress that we have made and help move our states toward reopening our country. We also received a report today, and the coronavirus task force, at this point, 5,528 military personnel have been deployed across 24 hospitals and facilities, and 28,700 National Guard are on duty. On the subject of supplies, the President spoke about this at length, but at the present moment, we have more than 9,055 ventilators on hand. We actually added 91 ventilators to that supply because of the production that the President and our task force at FEMA has activated. In the next 7 days, we'll be adding 576 ventilators to the strategic national stockpile. As the President mentioned, our air bridge continues to work, 64 flights completed, 50 more flights on the horizon, literally bringing in medical equipment from around the country and around the world and deploying it to critical areas. Finally, tomorrow, as the President announced, we'll be hosting a conference call with all of the nation's governors, all the states and territories from the headquarters at FEMA. And we'll be working with the governors to ensure them that we're helping them to review and evaluate the President's guidelines for opening up America again, the criteria that we believe is appropriate and necessary before states can move into any phase one change in the mitigation strategies, but also at the President's direction tomorrow. We'll be providing all the nation's governors and all of their health officials with detail about the testing infrastructure that exists all around the country. We'll be specifically providing governors and state health officials with information about all of the lab capability that exists in their states, and also we'll be updating them on our efforts to identify the kind of supplies the President just held up, and our efforts to make sure that those supplies are at all of those laboratories as the need should arise. Remember that a month ago, we had done 80,000 coronavirus tests in America. This weekend, we cleared more than 4 million, and we're currently testing more than 1 million Americans a week. We fully expect to actually have tested more than 5 million Americans before the end of this month. But at the President's urging, we're going to continue to scale that testing and then work with governors to make sure that they can manage and implement and deploy that testing in the manner that will most support their efforts to move their states forward. Remember that the testing that is contemplated in the guidelines for opening up America again for phase one are testing people that have symptoms that may be coronavirus, and then also having the testing resources to deploy to vulnerable communities, nursing homes, or other vulnerable communities that we have identified as needing additional what is called monitoring or surveillance testing. We believe we have the testing today around the country that would allow any state in America to move into phase one if they've met the other criteria of 14 days of consistent declines and strong hospital capacity so that the system would not be overwhelmed in the event of a flare-up. But we're going to be working with governors tomorrow on the subject of testing and supplies. And as the President said again this evening, we're here to help. We've forged a partnership with governors around the country, and tomorrow we'll be building on that partnership to hopefully arrive at the day that we can make sure governors around the nation have the best advice and the best resources to put America back to work. Thank you, Mr. President.
Very good. Seema, you've done such a great job. Please come up and say a couple of words. Thank you.
Thank you, Mr. Vice President, Mr. President. So just a few weeks ago, we stood here and asked the American healthcare system to delay elective surgeries and procedures. And the reason why we did this is we wanted to make sure that the healthcare system could deal with any surges. We wanted to preserve equipment and make sure that they had the appropriate workforce to handle any surge. And our healthcare system did a fantastic job. They very quickly stood up telehealth services, and under the President's leadership, we started paying for these services under the Medicare program. But the reality is not everything can be addressed by telehealth. There may be a woman that needs surgery for breast cancer, somebody who has cataracts in their eyes that need to be able to see better, and sometimes a doctor just needs to be able to listen to their patient's heart. We've heard across the country that doctors' offices have closed and many healthcare systems are furloughing their staff, nurses and doctors. Under the President's leadership, we've put out over $90 billion in accelerated payments under the Medicare program, provided $30 billion of grants with more dollars on the way. But thanks to the American people, we are in a much different place. You heard from the Vice President that there are many places around the country where they're seeing a decline in cases, and hospitals are reporting that they have unused capacity. And so as part of our Opening Up America, we are issuing guidelines today about how we can reopen the healthcare system. So these are recommendations around phase one. Now, every state and local official has to assess the situation on the ground. They need to make sure that they can still address surges. They need to make sure that they have adequate supplies and a plan for conserving supplies. They need to be able to screen patients and healthcare workers for COVID virus. And they need to make sure that patients feel safe when they come in to seek healthcare services by assuring that they have the appropriate cleaning in place and that they observe social distancing inside the healthcare facilities. And this isn't going to be like a light switch. It's more like a sunrise where it's going to be a gradual process. And healthcare officials across the country and healthcare systems need to decide what services should be made available. And ultimately, doctors and patients need to make decisions about their healthcare services. And we want to make sure that systems are reopening so that they can stay open and doing that in a very measured way. And I want to thank all the healthcare workers on the front lines who have done a fantastic job in providing care and comfort, serving as a liaison between family members. They've done a fantastic job, and we owe a debt of gratitude to them. And to all those providers that did adhere to our guidelines. They did the right thing, and it has made an extraordinary difference. I also want to take a couple of seconds here to talk about our nursing homes. Our hearts and minds are with the patients and the families of those living in nursing homes. This is an extraordinarily difficult situation. People living in nursing homes are of the most vulnerable patients. They're elderly. Many of them have underlying health conditions. And this has been a very hard situation. And I really appreciate the strong efforts of governors and local communities that have shown great leadership in supporting nursing homes across the country, particularly Governor Baker, Governor Hogan, that have had special efforts around supporting nursing homes. FEMA is also working on a plan to make sure that nursing homes have the supplies that they need. And just last week, we increased the reimbursement in the Medicare program for high throughput tests. And we are also paying for labs to go out to nursing homes to collect samples. And that's going to really support efforts on nursing homes in order to isolate patients. Today, we are also announcing, under the President's leadership, an effort around nursing home transparency. It's important that patients and their families have the information that they need, and they need to understand what's going on in the nursing home. And so today, we are announcing that we are requiring nursing homes to report to patients and their families if there are cases of COVID virus inside the nursing home. We are also requiring nursing homes to report directly to the CDC when they have cases of COVID virus. And this is very important, as you've heard Dr. Birx talk about. As we reopen the United States, our surveillance effort around the COVID virus will also begin in nursing homes. And so by having this reporting system, this will support CDC's efforts to have surveillance around the country and to support efforts around contact tracing so that we can mitigate the spread of the virus in those communities that show spread starting in the nursing homes. So again, I want to thank all of the local officials that have done an amazing job in supporting the nursing homes, and would urge all state and local leaders to follow their lead and do everything that we can to keep nursing home residents safe. Thank you.
Thank you very much. And Dr. Hahn is here. If you need, he'll tell you maybe a little bit later if you want this, but I can tell you that very simply, the level at which they're approving things, tests, and being on top of the people that are doing the testing for therapies and for vaccines they've never seen anything like this. So I want to thank you very much, and stick around. Maybe they'll have some questions. Okay? Please go ahead. In the back.
Mr. President, thank you very much. If there were groups of people planning to protest tomorrow against the government shutdown, what would be your advice?
Against the shutdown?
Yeah, that they want the shutdown lifted. Should they
Maybe
go
they want
ahead
to
if
lift it,
it's
yeah.
in a state where
Hey,
there haven't been
I
14
don't have
days?
any arrests. If people feel that way, you're allowed to protest. I mean, they feel that way. I watched the protest, and they were all 6 feet apart. I mean, it was a very orderly group of people. And but you know, some have gone too far. Some governors have gone too far. Some of the things that happened are maybe not so appropriate. And I think in the end, it's not going to matter, because we're starting to open up our states, and I think they're going to open up very well. We're going to be watching it. We're going to be watching it very closely. We're working with them on testing. We're working with them on whatever they need. I don't think they need ventilators anymore. I believe the term the governor used was phenomenal. We've done a phenomenal job. That was the term that was the only sentence they left out, which is okay. But I appreciate that that's what Governor Cuomo said. But they've done a phenomenal. These people have done a phenomenal job. As far as protesters, you know, I see protesters for all sorts of things, and I'm with everybody. I'm with everybody. Please, in the back. Go ahead. In the back. Go ahead. You ready? Yeah.
Yes, please. Thank you, Mr. President. Jen Pellegrino with OAN. Yesterday, you pointed out that Iran was likely not truthful in the reporting of the virus. Meanwhile, Senator Dianne Feinstein and other Democrats are looking for $5 billion in aid to Iran. Are you considering giving any aid to Iran?
If Iran needed aid on this, I would be willing to do something if they want it, if they ask for it. I would be certainly willing. They were hit very hard. Obviously, those numbers weren't correct numbers that they reported. But if they needed help, if they needed aid, if they needed ventilators, we have thousands of ventilators currently on hand, and ventilators under construction, that are under construction. That's a mosquito. I don't like mosquitoes. I don't like mosquitoes at all. But if they, yeah, we would certainly be willing to help. What they should do is be smart and make a deal. It's only because of, you know, you look at what happened. It's John Kerry, I guess, just doesn't want them to make a deal. And they're probably figuring they can wait. And maybe it will be Biden, and they'll own America if Biden gets. And they know with me, it doesn't work that way. It doesn't work that way. If Joe Biden got in, they'd own America. Between them, China, Japan, Mexico, Canada, they'd own America. You wouldn't have a country left if he got in. Go ahead, please.
Mr. President, the first question, you mentioned that you've seen some governors, I think you said this yesterday too, that some governors you think have gone too far. Which governors are you referring to, sir? Which states?
I don't want to mention names specifically, but obviously one we can mention that's this, but really much beyond this is Virginia with what they've done on guns. He is playing with your Second Amendment. We can't allow that to happen, and that is indirectly related to this because you know what's happened with guns. People are buying guns at a level that you haven't seen before because of this surge of plague. So what he did was totally inappropriate. Other than that, I'm not going to mention governors, but I have a list: 1, 2, 3, 4, 5, 6, 7.
On money, sir, you mentioned off the top that you hope that a deal may come tomorrow on the small business loan program.
Well, I hope so.
But, you know, this morning Mnuchin seemed like this was ready to go. It seemed like any second now. Is there any
Whatever it
changes
is,
there?
look, you know, every time you say it's ready to go, then they say, oh, we have a good negotiating position now because he just said it's ready to go. So now let's see what happens. But we want to take care of our workers. We want to take care of our small businesses. They're really the engine of this country. We have to take, when we open, we want to have those small businesses ready to go. We don't want those businesses abandoned because they couldn't afford their employees. They couldn't take care. And I want to take care of those employees.
Well, what's the holdup now, sir? Just in terms
I
of
can't tell you that. I can just tell you that we're negotiating with the Democrats, and you know they negotiate for things that we can't do, that we don't think are in the best interests of the people of this country. We are very close to a deal. I can't tell you whether or not we're going to get the deal or not. Who would say that? You want me to say we're going to have a deal before we have a deal? We have a good chance of getting a deal. A lot of good discussions were had today. We have a good chance of getting the deal. We want the deal. We want to take care of our workers. We want to take care of our small companies.
Mr. President, please.
Go ahead, please.
Thank you, Mr. President. I have a question for you and also for Dr. Hahn, if I may, after I get to your question.
Sure.
In your remarks that you made just a few moments ago, in regards to reopening the U.S. economy, you said, I want it to be safe. And that's a sentiment obviously shared
do.
by
No, I want it to be
tens of
safe.
millions of Americans.
I want it to be safe.
And it
actually.
seems at odds, Mr. President, with the tweet that you had on Friday about liberating those three particular states, Virginia, Minnesota, and Michigan, because none of those states, Mr. President, have met the requirements that the Vice President and others on the task force have talked about in terms of reopening the economy. Do you see those two
Well, if you
ideas at
take
odds?
Michigan, there were things in the Michigan that I don't think they were necessary or appropriate. Everyone knows that. I think the governor of Michigan, we're getting along very well, but I think the governor of Michigan probably knows that. I think she probably wished she didn't put some of them in. You can't buy paint, you can't buy seeds. I mean, where did this stuff come from? No, we're going to be safe. We have to be safe. And we don't want to close anything. We're not going to be closing, but we're going to be doing it beautifully, systematically. We're working very well with the governors. I mean, I would say pretty much almost all of them. A couple of them, no matter what you do, you'll never satisfy them. You could find the cure tomorrow, and they wouldn't be satisfied. They'd find a reason to complain. Wise guys. But for the most part, we're working very well with the governors. We have a great relationship with the governors. I can tell you, I've been on numerous calls with governors, and during those calls, I mean, without exception, they were friendly. And that's going back even a month from today. So I think that we're going to do a terrific job. I think the governors are going to do a terrific job, and we're starting to open our country. And, you know, as you know, I just spoke with Greg Abbott today from Texas. He's fantastic. He's a fantastic governor. And he's going to be opening up parts of Texas. And you're going to be opening up parts of other countries. You know what other states. And you know what that is. And by the way, other countries are at a point where they're starting. I see where Germany's starting to open up little sections. So there are a lot of great things happening. And we're going to start to open our country. And we're going to do it. It's like, as I say, it's like a beautiful puzzle. A state might even be a portion of a state. You know, there are states, very big states, and you can have portions of states, Mike. You have a portion, you have a county, which is perfect, and you have another county that's a sort of still pretty far away, even if it's within the same state, and it's not doing so well. But they may open up parts. So we're going to do it very, very carefully, and I think it's going to be very successful. But when you say safe, I want it to be very safe.
Thank you very
Hey, let him just do this one. Then go ahead, please.
Thank you very much, Dr. Hahn.
Doctor?
There's a question that I don't know the answer to, and I was hoping that you could provide an answer to. There's an epidemiologist at the University of Alabama in Birmingham who's actually a COVID-19 survivor, and his name is Michael Say. And his question is this: why would the virus suddenly be different? And why would people's susceptibility be any different on May the 1st, or on June the 1st, or on July the 1st? And this all relates to reopening the economy. Can you explain or give an answer to that particular question?
I don't think we have evidence that one would be more susceptible or less. What I think we can say is that the mitigation efforts have really helped with respect to this, and that what we've seen is the number of cases have gone down. And if we follow the gating criteria for the opening, we're then able to institute phase one and have the appropriate measures in place to actually reduce any chance of flare-up of the cases.
Is there a chance of a sort of rebounding if you reopen too soon without the type of mitigation efforts that we've had still in place?
Yes, there's a chance. And I think Dr. Fauci and Dr. Birx talked about this at the podium. And the key here is the surveillance that is being put in place with the CDC. I think that'll be a really great help in terms of trying to reduce that risk. Thank you.
And I think they have the rest of that clip. I just thought it was a very good clip. I think it's a tribute to New York. I think it's a tribute to the federal government. And I thought it was nice. So I think they have that now. They can try it. Go ahead.
Have we saved everyone? No. But have we lost anyone because we didn't have a bed, or we didn't have a ventilator, or we didn't have healthcare staff? No. The people we lost are the people we couldn't save. Not for lack of trying, and not for lack of doing everything that we could do as a society, not only as a government and as a healthcare system.
Okay.
Mr. President, you had called on me.
Yes,
Thank
I
you,
did.
I appreciate it. Since you shared with us something else that you saw on TV today, I have